Hi, I'm Dr. Stitzel, and this is the video consult for patients with adolescent idiopathic scoliosis. Adolescent idiopathic scoliosis is the category of scoliosis that makes up over 80% of all cases, so it's by far and away the most common form of the condition. And we've been doing a lot of research for this condition, and particularly in the area of genetic variant testing. Now, a genetic variant is like having a scratch on a record. So when you play the record, the music still works and still plays the songs, but there's blips wherever the scratches are. Well, these scratches are the genetic variants. We have discovered there are 28 genetic variants that are highly correlated with adolescent idiopathic scoliosis. So when we start looking at these individually, we started realizing very quickly that almost all these 28 genetic variants are related to either hormone metabolism or neurotransmitter production. This highly suggests that adolescent idiopathic scoliosis is actually primarily a neurohormonal condition that creates a spinal curvature as the most common visible symptom, and it's rooted in a genetic predisposition. So the long story short of what I'm trying to tell you is there's a lot more going on than what we can see on this x-ray. And if we want to be able to offer patients the most comprehensive treatment approach and best outcomes, we are going to have to learn to start thinking about treating the whole scoliosis condition, not only the curve. Now, typically for adolescent patients with scoliosis, we recommend 3 separate things that need to be used together in a system in order to produce the long-term results that patients and parents are looking for out of our program. The first would be doing the clinical testing. The clinical testing we recommend for patients with adolescent idiopathic scoliosis typically consists of that genetic variant test, which is a saliva test you collect at home, mail into the lab. In about 4 to 6 weeks, you'll receive a report. That report will detail and outline how many of the genetic variants they have out of the 28, which specific ones do they have, what do those do, how do they relate to scoliosis, and what nutrient therapies are recommended to help fill in those scratches on the record, right? So that when the music plays, there's no longer blips, and then we get a better performance, which is going to help us in the long term of overcoming this genetic signature that is causing this scoliosis condition in the first place. We also typically recommend a neurotransmitter test. Now, neurotransmitters are the chemicals in your brain that let your brain and your body talk to each other. We've discovered there are 3 separate patterns of neurotransmitter imbalances that are highly correlated and associated with adolescent idiopathic scoliosis. These serve as what we call a posture memory. Now, it's important to understand that human beings do not have conscious control over spinal alignment. So no one can wiggle 3 vertebrae just by thinking about it, right? And no one has to think about lining up their head over their body, over their pelvis, when they get up and walk across the room. So your spinal alignment is controlled by the part of your brain that controls all of your automatic stuff, like your breathing, your digestion, your heart rate, body temperature, all those sort of things. So human beings have a reflexive control, non-conscious, non-voluntary reflexive control over spinal alignment. Now, your brain doesn't want to have to do the math every time you get up and walk across the room to figure out how to align your spine to gravity, so it creates a shortcut. This shortcut is called a posture memory. This is a picture that your brain has, it is a picture in your brain that your body pulls out every time you get up and walk across the room. So instead of having to figure out where gravity is, it just pulls out this picture and says, do this. This is stored as neurotransmitter patterns. And if we want to change what a patient with scoliosis spine looks like on x-ray, we're going to have to change that posture memory. We're going to have to change that picture in their brain that's stored as neurotransmitter patterns if we want to change our spinal alignment. Otherwise, if they just continue to pull out the same picture, they're going to get the same result. And that picture is heavily influenced by those genetic variants. So by overcoming those genetic variants with nutrient therapies, by using nutrient therapies to rebalance those neurotransmitter levels, we're able to help that patient forget that old posture memory, and then our rehab can help them create a new posture memory through reflexive response training. The second recommendation we have for patients with adolescent idiopathic scoliosis is one of our in-office programs. We have a small curve camp program for curves less than 25 degrees. We have a 5-day boot camp program for patients with curves 25 to 39 degrees. We have a 10-day scoliosis boot camp program for curves 40 degrees and more. The 5 and 10-day scoliosis boot camp programs require a scoliosis activity suit. The small curve camp may or may not require an activity suit. It will be recommended by the doctor, but it is optional. We recommend the genetic and neurotransmitter testing with absolutely all of the programs, but it's also important to note that the genetic and neurotransmitter testing and nutrient therapies associated with those could also be used independently. It's also important to note that you do not have to do those tests and have that going and completed before you start the boot camp. This can all be kind of done simultaneously. The third recommendation, which I already alluded to earlier, was the scoliosis activity suit. The scoliosis activity suit is not a brace. Okay? It's actually the exact opposite of a brace. It's a personal rehab device for scoliosis. What's unique about it is going to create a active rehab process using the patient's walking motion as the motor for causing the brain to learn to untwist. It anchors off the patient's leg. Then there's a piece that captures the lower back. There's a piece that captures the rib cage area. And those three pieces all interconnect into a suit. There's then a tension strap placed according to the patient's curve pattern and rotation. So what happens is when people walk, the top half and the lower half of their body walk opposite of each other. So we walk opposite leg, opposite arm. This creates a twisting motion. Because the suit is anchoring off the leg, that torque from that twisting motion from walking gets transferred into the suit and creates a reaction with that tension strap. Now, what happens is that tension strap creates a reflexive reaction causing the spine to learn to untwist against resistance. Now, it's critical this is done against resistance because when you have a muscle that works against resistance, three things are going to happen. First, the muscle is going to get stronger, obviously. Number two, the muscle is going to start learning to fire in a coordinated way because they're all pulling against the same resistance in the same direction at the same time. So it recoordinates those muscle firing patterns. And third, and maybe most importantly, is anytime you have a muscle that's working against resistance, it's going to create a feedback loop back to the brain that's going to cause the brain to learn to adapt to that stress. That's going to help start creating that new posture memory. Now, patients are going to need to continue to do home rehab on a daily basis for a minimum of 4 to 6 months before reevaluation, because obviously we can't fix scoliosis in 5 to 10 days, okay? So it's a situation here where we can only create a new posture memory over time and with daily stimulation through this special reflexive response type rehabilitation.